Ladies and gentlemen, again I say, ladies and gentlemen, good morning and welcome to our webinar on cosmetic surgery. Now, I am speaking to you from Dubai in the Middle East, and our webinar by and large is being beamed out of India, Hyderabad to be precise, and our speaker is also from Hyderabad. Now, we have heard quite often about bariatric surgery. Now, bariatric surgery is a situation that helps individuals to begin an effective weight loss journey. We don't very often hear about body contouring or surgery for morbidly obese individuals. Now, this is an exciting, interesting, and I'm sure very complicated subject, because usually surgeons prefer to avoid surgery on morbidly obese individuals. Nevertheless, I am not an expert in this area at all. And we do have an expert who is going to talk to us about this today. And that is Dr. Chandana. Now, Dr. Chandana has decades of experience in cosmetic surgery in its various aspects. And what makes her specifically relevant to our subject today is the fact that she actively associates with surgery for obese individuals, which under normal circumstances, I may be wrong, I may be absolutely wrong, but under normal circumstances, most surgeons would prefer to avoid. Now, Dr. Chandana has studied out of India. She's a surgeon. She has studied out of locations abroad. She did a program, an extensive program in my home city of Dubai, aesthetic surgery. Anti-aging is one of her specialities in terms of surgery, post-bariatric surgery. Ladies and gentlemen, now this is the first time in the 5-year history of the weight loss challenge that we are having a cosmetic surgeon talking to us. Ladies and gentlemen, this is going to be very interesting. Now, Dr. Chandana is extremely busy, of course. We have had the good fortune that we were able to record our talk with her presentation. And at the end of this session, if we are lucky, we will have Dr. Chandana with us, to whom we can ask a few questions and clear our doubts. Ladies and gentlemen, Dr. Chandana Guduru.
Thank you, Professor Kennedy, for the introduction. I really do think multidisciplinary weight management gives the best results to the patients, and that Professor Kennedy and LivLife are doing a great job bringing specialists in to spread awareness and promote safe weight management. As part of the multidisciplinary management of weight, plastic surgeons can be involved in various roles. We can be your primary consultant and guide you through your weight loss journey, or we can help you by offering problem-specific solutions, like dealing with the stubborn fat that won't go away with diet and exercise, or dealing with excess skin and stretch marks that you get after weight loss. We can also help you move around fat from one undesired location and put it in a more desirable location by performing fat transfers. Or, just having us in your life can sometimes, waiting with a bill can push you away from every thought of a cheat day and a late night party with friends. Jokes apart, let's try to understand the types of fat in your body and how each impacts your health. So there are basically two types of fat. One is the internal fat that is present inside the abdomen under the muscles. This fat cannot be removed by surgery. But there's a good news. The good news is that this fat is metabolically active, which means that even just doing regular diet and exercise can easily burn this fat away. And it's important to do so because visceral fat or internal fat is a dangerous thing to have, and it can lead to liver disease, heart disease, and a lot of lifestyle complications, metabolic complications. Another interesting fact is that internal fat can be present even in otherwise very thin looking individuals. This is more common in Southeast Asians, especially Indians, who are genetically predisposed to have this kind of visceral fat and diabetes. So diet and exercise is important for even thin individuals. The next type of fat is external fat or subcutaneous fat. This is the fat that you can pinch with your fingers everywhere on your body. The sad part is that sometimes this fat can be quite difficult to lose even with rigorous diet and exercise. This can be because of a genetic predisposition for fat accumulation in those particular areas, and it's more common to have these in areas like the thighs and on the love handles on the sides of the belly. And the only solution to this is a surgical removal by a liposuction. Another concept that I want to explain is the difference between weight loss and body contouring. When we use the term weight loss, it indicates that all the fat, the internal fat and the external fat, is removed from the body. It must be reduced either naturally or through weight loss medications or injections or bariatric surgery. Whereas body contouring is the term that we use when we are talking about a procedure that will modify the appearance of the body by moving around the excess fat or dealing with the excess skin. So body contouring is suitable for people who are closer to their ideal body weight, and weight loss is for people who are of higher BMI and need to lose a lot of weight for a healthy life. So once again, weight loss is both internal and external fat loss, and it is good for people with higher BMIs. I'm not going to go in detail about weight loss procedures, but I can tell you that as a qualified medical practitioner, plastic surgeons are quite well equipped to help you select a weight loss technique when you come to us, and that we team up with our gastrosurgery and bariatric surgery colleagues and endocrinologists, and we provide weight loss solutions to you in our centers if you come to us. Now, body contouring is what we are known for, plastic surgeons, and like I said, these are the patients who have already lost a sufficient amount of weight and they want to deal with either the stubborn fat that is not going away or the excess skin, or it is for individuals who are just slightly overweight and they want to have a fitter looking body. So it is best to plan body contouring procedures when you have attained a stable weight for at least 6 months and you're maintaining it with regular diet and exercise. And also in the case of women who are suffering with post-pregnancy skin looseness, it is best to plan body contouring procedures after you complete your family. When you decide not to have any more children, that is when you should invest in body contouring procedures. So body contouring procedures, these can be surgical or non-surgical body contouring procedures. Non-surgical body contouring procedures use energy-based devices like ultrasounds, lasers, radio frequency, or thermal damage in the case of cryolipo to damage and melt the fat. And fat dissolving injections are also popular. These are suitable for smaller locations to melt away the excess fat. And some energy-based devices also promise to tighten the loose skin in smaller areas. But be warned that these are usually for select patients who have minimal fat or minimal skin looseness or laxity. Anyone with significant fat or laxity will not benefit from these procedures. These treatments are usually very superficial and target only up to a centimeter in depth of tissue. And if you think that the next time you can go 1 more centimeter in the next session, don't ever convince yourself that that is going to happen, because after each session of using a energy based device, your body is going to form a dense scar, and that scar is going to prevent the device from reaching further depth. This scarring is bad for another reason also, that the scarring is going to make any future surgeries that you plan complicated, meaning that the scar is going to make the surgery difficult. So as you can see in these images, these devices are being sold only for use in already fit individuals. Even the marketing posters are showing you the same thing. So don't waste your money on them if you think that you're not the right candidate for these toning procedures. They are only to tone your body when you're already fit. Even fat loss injections for that matter, don't try using them for larger areas like the abdomen or the thighs. Use them with caution. After seeing a qualified plastic surgeon or esthetician, use them for small areas like the double chin and for minor corrections only. Do not use non-surgical devices if you have significant excess of fat or significant looseness of skin. Rather, you should spend your money on something that is more long lasting and can promise you consistent results. So in the right hands, surgical body contouring procedures like liposuctions and tummy tucks are better suited for individuals with significantly more fat or loose skin. These procedures are targeted, they're reliable, and if done on the right patient at the right time, the results usually last a really long time. So these are cost effective despite sounding expensive in the beginning. And these procedures, the thing is that they are going to require some form of anesthesia. So you have to be fit for surgery. But the risks are reduced if you choose the right surgeon who is trained in the right technique. And they're usually safe and effective if done in the right patient at the right time by the right person. It is important to remember that results from body contouring procedures need a good diet and exercise routine to maintain them for a long time. You're spending a lot of money on getting the kind of result. You should maintain it after the procedure if you want them to be sustained for a longer duration. Let's talk about liposuction in detail. Liposuction is a body contouring procedure that is reserved for people who are just overweight and closer to their ideal body weight. That is between BMI of 25 and 30. So liposuction is definitely not for individuals who have a lot of internal fat or visceral fat. It can only remove the external fat that you can hold between your fingers. Liposuction is also not for high BMI individuals because you can only safely remove less than 10% of a person's body weight at one time. Let us understand what happens during a liposuction. So basically what happens is that long metallic tubes are passed under the skin through small hidden incisions, and medicated fluid is gradually pumped into the fat layer. This numbs the area and also decreases the blood loss during fat removal, and the fat cells are then slowly, carefully removed. These fat cells can be either discarded or they can be collected and transferred into another location if desired. So the question is, will the fat come back after liposuction? Fat cells which are once removed during liposuction are forever gone from that area. But not all fat cells can be removed from one area completely during liposuction. This is because you want to protect the blood vessels which supply the overlying skin. Damaging the skin's blood supply by doing extensive liposuction can lead to skin death, and it can leave a bad open wound or a scar if it is done by the wrong person, and then it will require a lot of complex treatment to correct it. This means that some fat cells have to be left after liposuction, and the fat cells that remain after the gentle liposuction can grow in size if the individual does not control weight by maintaining good diet and exercise routines after doing the liposuction. So liposuction is good for you if you can maintain it with diet and exercise later. Otherwise, the fat cells are going to grow in size. They have the capacity to infinitely grow in size. What happens when liposuction is performed on high BMI individuals? When liposuction is performed to remove large volumes of fat, the complications that occur due to liposuction can significantly increase. This puts the patient in risk, especially if they have other health conditions like diabetes and heart disease. Not only that, when a high BMI individual tries to get a liposuction to get a particular shape, we may not be able to remove so much fat in one session to give them that kind of body that they're paying for. So either way, it is not a satisfactory procedure to be done in a high BMI individuals. And all these factors make the liposuction in a high BMI individual both costly and unsafe. Rather, these patients would benefit from a weight loss procedure like an injectable weight loss medication or a bariatric. To summarize, liposuction is for individuals who have healthy habits and a BMI that is close to normal. Does that mean high BMI individuals can never get liposuction? Like everything else, there are some exceptions. Liposuction is sometimes offered to young and otherwise healthy individuals with a higher BMI between 30 and 34. This procedure may remove only a little bit of fat and slightly improve the appearance of the operated area, but it has been shown to have a lot of metabolic benefits. A meta-analysis of 24 studies was reported to show significant improvements in the levels of triglycerides, in serum glucose and serum insulin levels. Not only that, this kind of slim down liposuction motivates this person, this young and otherwise healthy person who underwent the liposuction, to pursue further weight loss and live a healthy life. So surgical procedures are there to address the excess skin and residual fat after weight loss, and these can be performed once an individual maintains a stable weight for over 6 months and has become used to regular diet and exercise. These are called surgical body contouring techniques. They're primarily lifts and in these procedures, the overhanging skin is removed in such a way that all the surgical incisions and cuts are planned so that they are hidden under the undergarments whenever and wherever possible. It's not always possible, but we try to hide them. These procedures can address the excess skin of various regions like the tummy, like the arms, the thighs, the breasts, or the back. These may be performed in one single session or by combining 2 or more areas in a session, allowing the individual to recover fully between the procedures. It's important to remember that most of these patients who've lost a lot of weight following bariatric surgery or have lost a lot of weight due to rapid weight loss programs, they usually have a lot of vitamin and protein deficiencies. So this also impacts the healing and recovery from surgery, and therefore you should be careful when selecting your team to perform these procedures. You should have experienced nutritionists and doctors on board to help you with massive weight loss body contouring procedures. Fat loss is not always desirable. Some people can lose fat in an area that they don't like having the fat gone from, like the breasts or the buttocks or the face. In these cases, fat from other areas may be removed by liposuction and transferred to a more desirable location. This is called fat transfer or fat grafting. Fat grafting is also used to treat another emerging problem. Fat from the face is lost following the use of injectable weight loss medications like Mounjaro and Ozempic. This is called the Ozempic phase. When the fat is lost, it makes the person look much older and deflated. So fat is safely harvested from other regions where there is some fat remaining. It is processed under sterile conditions to prevent infections and complications. Then the fat is added back into the face in precise amounts and in precise locations to make the face more youthful once again. I hope this was useful to everyone interested in weight loss, and I hope it helps them make an informed decision, especially when it comes to selecting a team with all the experts and experience needed to give them the kind of results that they desire. And thank you very much once again. You can find me in Hyderabad at LivLife Hospitals in Jubilee Hills or Citizens Hospital in Nalagandla by appointment. And I'm putting the link here for the same.
Good morning, doctor. Good morning, doctor.
Thank you.
Hello.
Are you able to hear me,
Yeah,
Mr.
yeah.
Srikanth? Yes?
Hello.
Good.
I'm not. Yeah, actually, may I speak to Dr. Chandana, madam? Right now is available.
No, we are currently in a webinar. You could talk to her at some later stage if you don't mind.
Okay.
Okay? We are currently in a webinar, so call her in about a half hour.
In half an hour. Okay. Can you book the appointment in Chandana, madam?
You could when you call her in half an hour. Okay?
Yeah, okay. Yeah, okay.
Thank you. Thank you.
Thank you.
Thank you. Well, that's lovely. Dr. Chandana seems to have got a quick appointment immediately post her very, very interesting discussion. Now, you know, there are a few things that Dr. Chandana said that were a revelation to me. And that is because I am a lay person when it comes to surgical procedures, etc., during weight loss. Now, one of the things that Dr. Chandana mentioned was a multidisciplinary team. Now, as I see that, you have, of course, the physician or the endocrinologist who would give you the weight loss medication. You have that, of course. But before that, you have the lifestyle specialist or the dietitian and the exercise expert who help you to lose and maintain weight loss. Then you have the physician or the endocrinologist who gives you the medication. And then you have the cosmetic surgeon. But before I come to the cosmetic surgeon, I'll talk about the bariatric surgeon. The bariatric surgeon then would take the high BMI cases above 35, 40 and help them to lose weight through bariatric procedures. And of course, you have the individuals who are overweight in the region of 30 to 35 BMI, overweight, quite healthy and fit, but have fat in areas that they would prefer to lose, or do not have fat in certain areas which they would prefer to have. Now, I know several of these cases, and that brings us to this exciting topic of body contouring. And that is what Dr. Chandana has spoken about. Removal of fat from certain areas and locating fat in other areas. Exciting. Very, very exciting.
Can open your camera.
Very, very exciting.
Hello.
Yes, Dr. Chandana.
How are you, Professor?
Thank you so much for that very lovely discussion and very educative for individuals like me who really didn't know the intricacies of what you said. Now, you mentioned, and frankly so, you mentioned that you needed a multidisciplinary team, or that a multidisciplinary team should work towards weight loss. And you were kind enough to commend the individuals of other disciplines who were part of the team. You spoke about the dietitians and the exercise specialists who you said were so essential to maintaining the weight loss that you might have removed, or even our bariatric surgeons might have removed. You also indicated that individuals above with a high BMI require a different procedure than a cosmetic protocol. But very importantly, in these days of looking good and looking beautiful, you mentioned that your cosmetic surgery would be relevant to individuals who were overweight, who wanted the perfect, in a manner of speaking, the perfect figure, who wanted to lose weight in certain areas, the buttocks or the thighs, and or conversely, may want to put on weight in certain areas, etc., if I may say, like the buttocks, etc. Now, this is revealing. Thank you so much for that. You also spoke about liposuction. You spoke about skin loosening, and you came up with an interesting statement, which we in the Middle East would be very interested in, and that is the Ozempic face, meaning that, well, Ozempic or medications help you to lose weight, but they make you look old. And therefore, cosmetic surgery is probably a good answer. If you can just add to that or explain that a wee bit, I'd be so grateful.
I'm sure that in the Middle East, you're seeing a lot of those effects following Monjaro use and Ozempic use. You've been using them for a while there, and a lot of young people have started looking very deflated and much older than their age because of the fat loss in the face. They've developed hollowness around the eyes and the cheeks, a lot of skin laxity that's not corresponding to their age. And these individuals definitely want to look more youthful when they've lost the weight. And surely we can find some fat. There's not a lot required for the face to get that fullness back. And we can find it in another area and then harvest it and put it back in the face where it belongs, in a youthful face. And it's going to give them that look that that is very desirable. And that's what facial fat grafting is about, especially in the context of Monjaro or Ozempic face.
Good, good. That's interesting. I didn't even think. Uh, I didn't even think about that. And you're quite right. You're quite right. Many people post Ozempic and things like that really don't look as good as they looked before.
Yes.
Because of the weight loss. Now, that is one point. The other thing that caught my attention is you spoke about non-surgical methods to melt fat, and then you mentioned that probably surgical contouring might be a better long-term alternative. Could you justify that or explain that to us, Doc?
Especially in the context of obesity and in the context of post weight loss changes, you see a lot of fat and a lot of loose skin in these patients. If they're either in the process of losing weight or they have lost weight, they have a lot of fat and a lot of loose skin in these situations. And non surgical devices are not going to be of any use in these conditions. Non surgical devices and non surgical methods are useful for patients who already have a good enough body, which is close to the ideal body weight. They have just minor irregularities, minor areas where they want a little more toning, is the right word for it. They want a little more toned up body. In these cases, non-surgical methods are useful. But if you have a significant amount of laxity or you still have a lot of fat to lose, non-surgical methods are not going to help. They're only going to make future procedures more complicated.
Okay. Now, post bariatric surgery, you would have a lot of loose skin. I would imagine that you might have a lot of loose skin.
Mm-hmm.
And you have spoken about, I don't recall precisely, but you have spoken about stretch marks and loose skin.
Yes.
So would you say that post-bariatric surgery, when there seems to be a lot of hanging of tissue or skin post the body, cosmetic surgery may be a good recommendation?
Yes, if it's a young person and even an older person, it becomes a hassle to be, hygienic when you have a lot of hanging skin. There's a lot of bacterial and fungal growth in those areas. It smells bad. It's difficult to keep up with that skin. You still feel like you're carrying that weight around, the weight of the excess skin and all the tissues that used to supply the fat. They're still there. The fat is gone, but the tissue that used to support the fat is there, and it adds to the weight of the individual. It is a hassle to maintain it. It's clean, keep it clean, and it looks bad if you want to wear the kind of clothes that you want as a young person. It looks bad. So for all these reasons, sure, you should go for a body contouring technique if it makes you feel better and look better, and it makes your life more comfortable.
Okay, now a trick question, if I may say so. It's rather unkind of me to ask trick questions, but you seem to be so much in command of your subject, Dr. Chandana, that I will take the liberty of asking a trick question.
Sure.
And that question is that you have mentioned that cosmetic surgery is good, it delivers the result, but if you do not maintain appropriate diet, exercise, lifestyle, it would ruin the benefits that you have given for a period of time. So what would be your advice post cosmetic surgery in terms of maintaining good health?
Fairly simple. Once you've lost the weight and once you've stabilized and you're already used to a certain lifestyle, you're doing the exercises, you're maintaining the diet, you've spent a lot of money on getting rid of the excess skin or leftover fat pockets. You've done all that, and then if you don't maintain it, if you go out for frequent parties, or and you're not taking care of the diet that you're supposed to be taking after a certain procedure, obviously you will gain weight and lose the benefit of what you've had before. And this is not the first time it has happened. We've seen on Netflix, there was recently a show called The Biggest Loser documentary. This is in the early 2000s, and that was when there was not a lot of awareness. And a lot of people had lost weight rapidly in an unscientific manner on the show. And post surgery, post weight loss, they went in for a lot of cosmetic surgeries to get rid of the excess fat and the excess skin, and they were promoting it widely. But later on they went back to their lives and they did not take care of what they what they achieved, and it all came back. So, what money and effort you've spent on doing these procedures, if you don't maintain them, there's no point of putting your body through so much stress, to be quite blunt. So, you have to have the motivation, and we do check for that before we plan surgery. We tell the patient that you're going through so much, you're taking a risk, you're going under the knife, you're going under anesthesia. You should be able to invest that kind of time and effort to maintain what you've achieved. That's the point of it.
Okay. Doc Chandana, I frequently, as a professor, of course, I frequently come up across individuals who, by virtue of their given structure, their genetic profile, or whatever it is, I tell them, I said, look, you can't be a Mr. Universe or a Miss Universe because of your current body structure. It seems to me that the body contouring aspect of cosmetic surgery, the removal of fat from difficult areas like the thighs or the hips or some such thing, can completely reasonably reshape the individual, which means that it would give you exactly what you wanted, in a manner of speaking, which originally your structure didn't permit. So would you then say that, well, I would say, I don't know whether you'll agree with me, that body contouring is almost like a dream come true?
I would say that it's a matter of perspective. If it is what makes you feel comfortable, if it puts you ahead in from a place you're stuck thinking about regularly, if you can overcome that. I've seen women with fairly large fat pockets on the sides of their thighs. They're otherwise very fit individuals, but because of the side, it's unfortunately called saddlebags. Because of these, they can't wear clothes that normal individuals, even modestly, would wear because it looks odd. The rest of their body is fit, but because of the genetic predisposition, they accumulate fat in the wrong areas where it's a storage fat. It's just nature's way of putting something there for you as a reserve. But it looks bad and it makes your life a little uncomfortable. You can't find the same size of clothes that fit your upper body well for your lower body. It's an issue of, living your life comfortably and getting unwanted attention when you don't want it. And yeah, for those individuals it is a dream come true. And if it is a matter of your career, or if it's a matter of lifestyle, or if it's what makes you happy, you should do it. And if not, if you're comfortable in your body, we're not going to push you to do anything. A surgery is a surgery, and it's a personal decision. That's what we like to say.
Dr. Chandana, I have to tell you that you are eloquent and you represent your cosmetic surgery discipline extremely well.
Thank
I have
you.
to thank you very much for this enlightening talk. I mean, anything that can be done to help individuals who are overweight, whether it's cosmetic surgery, whether it is, well, I should say cosmetic surgery, I'm going to put last, whether it is Ozempic, or whether it is weight loss management through diet and exercise, or whether it is bariatric surgery. I think that cosmetic surgery and continued diet and exercise is probably the icing on the cake.
It is.
Thank you so much, Doc. I will keep in touch with you the next time I am in Hyderabad. I would come and chat with you. You already have an individual who's trying desperately to get an appointment. Please do help him out. Thank you so much, and have a great day.
You too, sir. Thank you.
Thank you. Friends, our next webinar is again next week. Today is the 20th, so that would be on the 27th. And we will talk about body load. And that would be the impact of weight on locations like your knees and hips. And then that would automatically take us to things like replacements, etc., etc. So keep listening and join us next week for our orthopedics and obesity webinar. Thank you and have a great day.